Welcome to our deep dive into the principles of periodontal instrumentation. In this video, we'll explore the core concepts that guide effective dental care, focusing on the techniques and strategies that ensure successful outcomes. Whether you're a student, clinician, or simply curious about dental procedures, understanding these foundational principles is crucial. We'll start by outlining the prerequisites for effective instrumentation, then move through positioning, visibility, stabilization, activation, and finally, scaling and root planing. Let's begin by setting the stage for what makes periodontal instrumentation both an art and a science. Effective periodontal instrumentation relies on several fundamental prerequisites. These include accessibility, visibility, illumination, retraction, instrument condition and sharpness, stabilization, activation, and maintaining a clean field. Each principle plays a vital role in ensuring that dental procedures are performed safely and efficiently. By mastering these basics, clinicians can provide optimal care and minimize complications. In the next scenes, we'll break down each principle, starting with accessibility and proper positioning for both the patient and the operator. Accessibility is the cornerstone of effective periodontal instrumentation. Proper positioning of both the clinician and the patient ensures that procedures can be performed comfortably and accurately. The clinician should adopt a neutral seated position, with forearms parallel to the floor and weight evenly balanced. Thighs should also be parallel to the floor, and the hip angle maintained at 90 degrees. Keeping the back straight and the head erect helps prevent fatigue and injury. For the patient, a supine position is ideal, with the mouth close to the clinician's resting elbow. Specific chin positions are used depending on whether mandibular or maxillary treatment is being performed. Let's look closer at the clinician's positioning. The forearm should remain parallel to the floor, ensuring ergonomic comfort and reducing strain. Thighs must also be parallel, with weight evenly distributed. The hip angle should be at 90 degrees, promoting stability and ease of movement. Maintaining a straight back and erect head is essential to avoid overflexion of the spine, which can lead to musculoskeletal issues over time. These positioning guidelines are designed to support both the clinician's health and the precision of periodontal procedures. Patient positioning is equally important. For most procedures, the patient should be in a supine position, with their mouth close to the clinician's resting elbow. This allows easy access and reduces unnecessary movement. For mandibular treatments, a chin-down position is recommended, while maxillary treatments require a chin-up position. These subtle adjustments help the clinician access different areas of the mouth with greater ease and visibility, ensuring that each procedure is performed efficiently and comfortably. Visibility and illumination are critical for accurate periodontal instrumentation. Direct vision is preferred, using direct illumination to clearly see the treatment area. When direct access is limited, clinicians rely on indirect vision, often using a dental mirror. Transillumination is another technique, where light is directed through the tooth surface, especially effective for anterior teeth due to their thin structure. These methods enhance visibility, allowing clinicians to identify and treat issues with precision. Retraction is essential for improving visibility and protecting soft tissues during periodontal procedures. Clinicians use mirrors or fingers to retract cheeks, lips, or tongue, creating a clear field for instrumentation. This not only enhances visibility, but also safeguards the patient's soft tissues from accidental injury. Proper retraction techniques are a fundamental part of maintaining a clean and accessible working area throughout the procedure. The condition and sharpness of periodontal instruments are vital for effective treatment. Dull instruments can compromise precision and increase the risk of tissue trauma. Regular inspection and sharpening ensure that tools remain in optimal condition, allowing clinicians to perform scaling and root planing efficiently. Maintaining sharp instruments also reduces operator fatigue and enhances patient comfort, making it a key aspect of successful periodontal care. Instrument stabilization is achieved through proper grasp and fulcrum techniques. The modified pen grasp is most effective for precise control of periodontal instruments, allowing for delicate movements and accuracy. The palm and thumb grasp is useful for sharpening instruments and manipulating air or water syringes. A finger rest, or fulcrum, stabilizes the hand and instrument, with the ring finger generally preferred. These techniques ensure that the clinician maintains control and stability throughout the procedure. The finger rest, or fulcrum, is a critical component of instrument stabilization. By resting the ring finger on a stable surface, clinicians can anchor their hand and maintain precise control over the instrument. This technique minimizes unwanted movement and enhances accuracy during periodontal procedures. The fulcrum also helps distribute force evenly, reducing the risk of fatigue and injury for the clinician. Instrument activation begins with adaptation, ensuring the working end of the instrument conforms to the tooth's contour. The cutting edge is divided into 3 sections: leading third, middle third, and heel third. Proper adaptation allows for effective removal of deposits and minimizes tissue trauma. By focusing on the leading third, clinicians can maintain optimal contact with the tooth surface, enhancing both precision and safety. Angulation is another key aspect of instrument activation. Different procedures require specific angles for insertion, calculus removal, and gingival curettage. For insertion, the angle should be between 0 and 40 degrees. Calculus removal is most effective at 45 to 90 degrees, while gingival curettage requires an angle greater than 90 degrees. Understanding and applying these angles ensures that the clinician can perform each procedure safely and efficiently. Maintaining a clean field is essential for both visibility and infection control. Throughout periodontal procedures, clinicians must regularly clear away debris, saliva, and blood to ensure a clear view and reduce contamination risks. This is achieved using suction devices, air, water syringes, and careful technique. A clean field not only supports accurate instrumentation, but also enhances patient safety and comfort. Scaling and root planing are fundamental periodontal procedures. Scaling involves removing plaque and calculus from both supra- and subgingival surfaces. Root planing goes deeper, removing residual embedded calculus and cementum to produce a smooth, hard surface. These procedures are essential for restoring periodontal health and preventing further disease progression. Proper technique and instrument selection are key to achieving optimal results. After scaling and root planing, evaluation should not be conducted earlier than 2 weeks postoperatively. The primary criterion for success is tissue response, which indicates healing and effectiveness of the treatment. By allowing adequate time for healing, clinicians can accurately assess the outcome and plan further care if needed. This final step ensures that periodontal health is maintained and any issues are addressed promptly.